The test and trace system in England came under fire this week over longer waits for test results. In an effort to track the spread of the virus, the government has today rolled out a new scheme. After a successful trial, 90 wastewater treatment sites in England, Wales and Scotland are to start testing sewage for traces of the virus to try to detect local outbreaks before they spread. Here's our health editor, Hugh Pym.
It's a new approach to tracking down coronavirus, monitoring sewage in local communities. This is an early warning system, as fragments of genetic material from the virus can be detected in wastewater. Scientists say its real value is in areas where there might be people who are infected but showing no symptoms.
The beauty of this technique is that we can detect people who are in that situation. They don't know they've got the virus, but they're still shedding it. We can still find it in the wastewater, and we can find it in advance of there being any positive tests in a catchment.
Samples from sewage plants reach labs for testing the next day. The results are passed on to local health leaders. In Plymouth, an outbreak was detected despite relatively low numbers of people going for tests. Data is also shared with national experts at the Joint Biosecurity Centre. The aim is to support the work done by test and trace staff. But in England, the testing and tracing system has come under intense strain. Performance figures for time to get results back and tracing of contacts have fallen to their lowest levels since the launch in May, though it has had to deal with rapidly rising case numbers.
Perhaps we wouldn't have seen ourselves in the situation that we are in now if that had been a bit more.
Some experts argue that the national system could have been better planned and prepared.
I think the intention behind setting up test and trace was well intended and well-meaning, and actually was there to meet a desperate need that we had at the time. But perhaps it wasn't as familiar with the challenge that it faced, and perhaps therefore does not have the capacity set up to deal with it adequately.
While the national setup can be struggling, local public health teams like here in Hertfordshire are taking on more of the tracing work to try to ensure infections don't spread and get out of control.
We have a call centre. If we don't get through, we can go and knock on doors. And that, of course, is reassuring for people when they see someone and hear someone, and also then to collect the information that we need that helps us identify locally, perhaps the sort of clusters and where the infection might be spreading that the national information may not be getting.
Sewage monitoring will add to the range of techniques health officials can use at this critical stage in the bid to seek out and control the virus. Hugh Pym, BBC News.
The latest government figures show that there were 20,530 new coronavirus infections recorded in the latest 24-hour period. That's down around 700 on yesterday's figure. The average number of new cases reported per day in the last week is now 20,250. 993 people had been admitted to hospital on average each day over the week to last Friday. 224 deaths were reported. That's people who died within 28 days of a positive COVID-19 test. That means on average in the past week, 163 deaths were announced every day. And it takes the total number of deaths so far across the UK to 44,571. Well, our health editor Hugh Pym is here with me. And Hugh, how would you assess the prevalence of the virus now?
Well, Reeta, we've had these indications today that the virus numbers might not be expanding quite so rapidly. First, the R number, the reproduction number, anything above 1 shows that it's spreading fast. Anything below 1 shows it's declining. It's still above 1, but the top end of the estimated range has come down a bit to 1.4. And as we heard, the ONS thinks from its survey that infections are not rising quite as rapidly as they were the previous week. But it's still going up, the case numbers, and hospitals are still under pressure. We've had reports today from hospitals in Glasgow, Manchester, Liverpool and Birmingham of rising patient numbers with COVID-19, and that of course reflects cases first diagnosed a couple of weeks ago. So a lot of uncertainty about where things go from here, and attention is focusing more on Christmas, after a senior health official in Scotland said yesterday families should be prepared for something very far from normal, maybe a digital Christmas. Well, today the Prime Minister's official spokesman said with regard to England that it was their ambition that families should be able to celebrate at Christmas if possible. But soon after, a senior advisor on the Sewage committee said only radical action to reduce infections would ensure anything like a normal Christmas.
OK, Hugh, many thanks. Our health editor, Hugh Pym, there.